Heard all my meetings,
Okay.
but okay. And I've got Kylie with me too. She's just gonna say hi.
Okay. Hi.
So we're both here.
Okay.
But all right, yeah, so tell me like what's driving all this? Where is this all coming from? What are your symptoms? What are you wanting? What are you trying to make happen?
So, um, I did a sleep study that basically kind of confirmed that I breathed through my mouth my whole life. Um, I have I did a cone beam scan that showed a very narrow airway. I've done the nose strips that really help at night. So I guess that's a sign that it's part of it's my nose. Dr. Cripps said like after looking at my mouth, so the palate's very narrow and vaulted. And then my like from a side profile, it's very flat. So it's pushed
Tell me,
back.
let's see. Tell me.
Oh,
Okay,
so
go sideways, but don't smile, just relax. Will you put your hair behind your shoulders, please? Turn away from me just a little. Yeah. You're so cute. Look, you're so cute. Okay. Can I see inside your mouth?
yes.
Okay.
Okay,
Hold
so
down here. Go ahead. Go ahead. Yeah. Go ahead. Yeah. Hold your cheeks out. Yeah. Bite down.
so my lower jaw is much wider, I think, than I upper. I can't.
Okay. Open big. Open real big there for me. Okay. So do you have your premolars or are you missing your premolars?
I have all my teeth except my wisdom teeth are still not have not come down.
Okay. Okay.
So yeah, but I just have I guess it's just in the back, especially it's pretty narrow. So I can't fit my tongue up to my mouth, the roof of my mouth with it's very scalloped, my tongue. Um, and I'm trying to think of what else. She did a whole exam on me, Miss Dr. Cribbs. But it basically like confirmed that what I always was sick all the time, snoring all the time, tired all the time. Everything that, I've in doing all my research, it looks like this is the problem, is like underdeveloped upper jaw, all of that. So, um,
Does your
surgery,
husband know you snore?
I snore, yeah.
Does your husband know that?
Mhm. Yeah, he's always wanted me to get checked, but I thought it was just normal because ever since I was a child, it's been an issue.
Okay. You guys, how old are your kids?
2 and 1. So that's what I was going to ask. I think my 2-year-old might need something too because he has, I don't know, underbite or overbite. His bottom teeth are in front of his upper teeth.
Mm-hmm.
And I saw that you work with 2-year-olds. So is it the time for him to have something in his mouth? So would I take him to Dr. Cribbs and
Yes.
and she would send you his information?
Yeah, she could take care of him. Is he there now?
He is, yeah.
You
He's
mind if
just
I look at him?
yeah, let me see if hopefully he'll be compliant. Let me see.
Okay. If not, that's okay.
Okay. Can you do a big smile? Can you do cheese? Cheese. Can you show him your teeth? Cheese.
What's your name?
Can you say, I'm Caleb? I'm Caleb.
Hi, Caleb. I'm Nate. It's nice to meet you.
So his front bot teeth come up in front of his lower teeth. Can you look
And
that
bite
way?
down like this. Caleb, can you go like this?
Go like, can you look at, see that? Can you go like this? Can
Okay. Let's
you
see.
see it? I don't know.
Ah, good job. Oh my goodness, Caleb, look at those teeth. Awesome. Okay, Leah, how many teeth does he have on the top? Caleb, can we count your teeth open big like an alligator? Ah.
Mama's gonna count your teeth. You got 1, 2, 3, 4, 8.
Okay, he has eight.
And I think maybe there's some coming in the back. How many is he supposed to have?
Okay, so he has eight. So usually kids get 20, 10 on the top, 10 on the bottom.
Oh, so is he, let me see. Maybe I didn't count. Hold on. Open up. Open up. One, two. Yeah, no, eight.
Right? And then it doesn't look like he has much space between his baby teeth in the front. Does he have space between them or not really?
Um, there's a little space on that one. Not really though. Hold on. Open your mouth. Open your mouth. You gotta show your teeth. You show your teeth to the camera?
Maybe he's not done. Caleb, you did so good. Thank you, Caleb. You're all done. Thank you.
Okay, I'm gonna put them back. So, so would he start to something, or does he not have enough teeth?
How's his sleeping?
He's sleeping. He seems to be sleeping fine.
He sleeps fine.
Uh-huh.
No big deal there. Okay. Um, let me see if I can pull up a couple examples for you. I'm gonna do a share screen here. Can you see my screen?
Yes.
So this is a child on the left here. We started at age 2 with 8 teeth on the top.
Mm-hmm.
And you see the lower jaw going back a little bit,
Yeah.
and we get both jaws more forward. So
Yeah.
it's like his upper jaw is back, but his lower jaw is usually probably back a little bit too. Same
Mm-hmm.
thing her. She had 8 teeth, one, two, three, four, five, six, seven, eight, 8 teeth on the top. You could see they're a little crowding,
Uh-huh.
and she was mouth breathing, waking up, snoring, stopping breathing, just not breathing or sleeping as well.
Mm-hmm.
And we developed her out, and then her new teeth came in the back there. So he has two
Okay.
teeth coming in.
Mm-hmm.
So if he's sleeping fine, like if kids are not sleeping well, I recommend treating them as soon as possible.
Mm-hmm.
There's there's a clinic in Stanford that is treating kids starting at 1 month old.
Wow.
Yeah, to help them breathe and sleep better. But this is
With
so
no
bad.
teeth?
Yeah, that's right. Yeah,
Wow.
yeah. But if he's breathing and sleeping okay, then I would say, can you still see my screen?
Yeah.
Okay. But if your son's breathing and sleeping okay, then I would say let's just wait until he has his back molars in.
Okay. And is that around 3 or 4?
Usually two, 2.5.
Okay.
But tell me if you can. There's some videos down here on the bottom. Can you hear that?
Oh.
His chest is all pulling in. He's trying to get air.
Yeah, that looks so sad.
His tongue is back there blocking off his breathing.
That's so sad. Oh my goodness.
As adults or kids or adults, when this happens, the lungs are trying to get air right now, and they're not
Oh.
getting it from out here because the tongue is blocking the airway.
Mm-hmm. Oh.
So the tongue is blocking the airway, so he's like struggling. So when that happens, then the lungs pull air from the stomach, and then people get stomach acid coming up and down in their airway, and it's part of like some people who have acid reflux, it's really sleep apnea.
Oh.
It's also a source of postnasal drip. So as we're sleeping all night, laying down sideways flat, then then it's like it causes inflammation in the back of the nose and the sinuses and stuff.
Right, that makes sense.
Oh, but they do a little mouthpiece.
Wow.
So we got a little mouthpiece helping to get the jaws forward.
Wow.
You see quiet, calm breathing.
Oh.
Yeah. So, but
Oh.
yeah, but if he's sleeping fine, then let's wait till he get his back molars in. As soon as he get those back molars in, I would get an appliance and help him get that upper jaw growing forward.
Okay. Okay.
Because
Great.
the sooner you get that forward, just the better in the long run.
Right.
And it's a little challenging, working with him, but I will say it's easier when they're younger than when they're older. Like he had something kind of similar. You see the upper behind the lower on that left side,
Oh yeah.
and we get them both forward more.
Mm-hmm.
So she had something similar. See how flat that mid face is there?
Yeah.
And it's coming out more
Oh
forward.
yeah. Wow.
The upper teeth are just really far back.
Mm-hmm.
So we can do stuff when people get older, but it takes longer, it takes more effort and energy. If
Mm-hmm.
a 2-year old, his jaws are growing at a super fast rate right now.
Okay.
If you can get his jaws growing and get that upper jaw, it would be really, really nice for him.
Okay.
Yeah. Um, but okay, so where does that? Okay, so yeah, so that's your son. Okay, Leah, can I come back with you a little bit now?
Yeah.
So sit up straight and tall, good posture.
Okay.
Close your teeth together, teeth lightly touching, lips together, breathing through your nose. Just feel how that feels. Okay, so I saw you kind of
I,
open your mouth a little bit.
yeah.
Why'd you do that?
It's just harder to get air.
Okay. So when you have your
Like I
teeth,
feel like,
when you have
yeah.
your teeth lightly touching in your regular bite, close your lips. Is it easy to relax your muscles here?
No, they're always tense right here.
Kind of tense, more so.
Mm-hmm. Mm-hmm.
Separate your teeth a little bit. Is it easier to relax your muscles with your teeth separate or teeth together?
Separate.
Okay, teeth separate, you could relax a little easier.
Mm-hmm.
Okay. Close down all the way again. As you separate your teeth, notice what happens with your tongue if your tongue has a little more room in your mouth.
Yeah.
What does your tongue do? What do you notice with your tongue?
It goes forward.
Okay. And that's like we get this airway space, right? So like here's one of our patients, but see this front to back is 7 millimeters right here,
Mm-hmm.
and this front to back is 16.
Yeah.
We kind of see smaller jaws, but we get bigger jaws.
Mm-hmm.
So when we get the jaws like developing, but our tongue, as the tongue comes forward, we get more breathing space,
Mm-hmm.
right? I think it kind of shows it a little bit here too. So this is like back of the tongue to back of the throat is 6 millimeters. Back of the tongue to back of the throat is 15 millimeters.
Mm-hmm.
So this person is going to tend to want to open the mouth to give the tongue a little more room in the mouth and get it out of the back of the airway.
Right. I think,
Where
yeah, that's what it feels like I'm doing.
Yeah, whereas this person, they can keep their mouth closed and relaxed and they can breathe fine,
Mm-hmm.
right? But so this tells me, yeah, your tongue could use some more space in your mouth.
Mm-hmm.
Um, but it's like having appliances, having things in your mouth is like a lot to hassle with and deal with.
Mm.
So I've had patients that were like, okay, yeah, let's help you, but then, they don't want to wear their appliance or do anything on their appliance, and so ultimately they don't get any benefit from it.
Yeah. So I mean, feel like I'd be pretty compliant because I'm stay at home with the kids all day. So it's not like I'm, you know, I don't know. I'm not out socializing a bunch. And even if I am, it's at the park. I really don't care.
Yeah,
I know it probably doesn't feel comfortable. Um, but I feel like this stage of life is probably when I'd be the most compliant with it.
that's good because you don't want to snore, you want to breathe better, you want to sleep better.
Yeah, and I'm driven to just fix it too.
Yeah, and you want to fix it. Yeah,
Hmm.
no, that makes sense. So here's a person that, let's see, wait. So can you see this lady?
Hmm.
So her jaws are trapped in, and this is what I see with you a little bit. Kind of teeth leaning in, that lower jaw trapped in behind the upper,
Hmm.
a little bit of an overbite, but she got some jaw tension when, she was like closing her teeth. She wanted to keep her mouth open. So kind of small mouth. She gets this bone down here is from a lot of clenching. So the
Uh,
more we clench, we get this extra bone growing down there.
okay.
Yeah, I don't know if you have that or not.
I'm trying to feel.
Okay.
Kinda. Not to that degree, but
So she, like, at first she didn't really wear her appliances because they're uncomfortable. You don't have tongue space. So now
hmm.
we're putting something in your mouth that gives you even less tongue space. So she's got some appliance in there.
Hmm.
Okay, and you can see it's not even fitting right. So it's
Yeah.
not even, it doesn't even fit in her mouth as well because she's turning the key, but she's not wearing it because it's uncomfortable because it takes up her tongue space.
Hmm.
So she's doing okay with the bottom. The bottom one fits okay. She's doing better with the bottom than the top. But I told her, I said, Leon, if you want, this will help you, but you've got to wear this. Like you're turning the key, this is opening up, but you're not really getting the results because you're not wearing it. And she's
Hmm.
like, well, it's hard for me to wear because I don't know if it's really going to help me. I'm like, it will help you. So I had to spend an hour talking to her, encouraging her, telling her it's going to help her. And anyway, so ultimately she started wearing it a little bit better. You could see this space opening.
Hmm. Hmm.
And then we filled that space in. We did some fillings. So we did some fillings in here to kind of close up that space.
Hmm.
So this is her smile.
Aw.
Yeah. But we unrestricted her bite. She's got a little more space. Her lower jaw's not trapped in or locked in.
Hmm.
And she's opening. So she feels a lot better. She's breathing better. She's sleeping better. But at first it was like a little bit of a challenge for her, right?
Right.
One sec here, Leah.
Still have to scan and then see how many minutes you could start somebody. I think Ari Kim is getting prices and February. But she said a Ramosa, so I'm not sure.
Oh yeah, oh gotcha, gotcha. Okay, thank you. I'll do that.
I'll let her know we'll be on the way.
Okay,
Still Euchre scan and then where's this?
thank you. Okay, so here's this guy. He was having trouble breathing. His jaws were kind of trapped in, and we put this in his mouth.
Is that a Marpy?
This is a Marpy. So this widens him out. These screw up in there. And we release the bone. So I do my little piezo to release the bone.
Okay.
And that can be done all the way front to back. And
Okay.
that open up the space in the front,
Mm-hmm.
or it could just be done in the back. So so if we do not want to open up space in the front, and
Mm-hmm.
we wear a retainer while we do it to keep the front teeth together,
Right.
and probably turn it at a little bit slower rate.
Right.
So it's
Okay.
less likely to open up the front.
Okay.
But this is like, um, so anyway, but he's breathing way better through his nose, breathing way better through his mouth. He says it's changed his life. He's in some Invisalign now, so he's got some Invisalign closing that space
Mhm.
up, bring his bite back together. But what we're trying to do here is just open up his breathing space. So, like, where his breathing space is here to here, getting wider space in here so there's more room for airflow.
Right. Right.
Yeah. Let me see your smile close up there, Leah. Yeah, yeah, come in a little more. Yeah, okay. Thanks. Yeah. I mean, yeah, your teeth look so nice. It's like,
You can see the first like six, but you can't, none of them back ones, they're all like kind of go right back.
yeah, they're
So
kind of,
my tongue is pretty like scalloped back there.
yeah, yeah, right.
Yeah.
Um, so let's see.
Could you do a face mask with it?
No,
No.
no, um, like I don't think that's gonna do a lot. Like I know people are talking about those a lot. I mean, you could certainly try one. There's no harm in it.
Okay.
I just don't know if it would do a lot.
Hmm.
This is someone, she was happy how her front teeth were. They were straight in the front, but she's kind of narrow. You can see the upper jaw is a little smaller.
Hmm.
So we did our thing. We
Okay.
oh, we just did an incision just right here in the back, and then I went in with my piezo and just released the bone.
Okay.
No stitches. This was not flapped over. This is a super small opening.
Okay.
She didn't even take any ibuprofen or anything.
Okay.
She said it was a little sore, no big deal. She didn't need to take anything for pain.
Hmm.
We put her appliance in,
Hmm.
and then this is just opening, widening out just the back.
Okay.
So you see how this is just on the back teeth. There's no screws screwed into her palate like that other one.
Hmm.
So, but that starts to widen her out a little more. So,
Oh
kind
yeah.
of
Wow.
still hang a little bit, but yeah.
So what would you recommend? The one with the like tads or the one like what she has?
Well, it's so if you want to get the nose breathing, again, like the TADs are gonna help the most because they're gonna translate up into the nose to open up that nasal space.
Okay, then I'd rather do that, probably.
Yeah. So, yeah.
So it's essentially a Marpy with a retainer for the front teeth.
Mm-hmm.
Okay.
Hmm. because we want to hold those front teeth together. We want to keep that bone together.
Right.
Yeah.
Yeah, I mean that makes the most sense to me. I've looked into the, MARPEs or MSE or whatever, but I haven't ever seen any option or anyone that's willing to keep the front closed because I can't do that, with my implants. So
Yeah. Do your tongue suction for me. And let me look in the top of your mouth. Yeah.
I can't keep it
Yeah.
really.
It's a little tricky, but it looks like your tongue's kind of going over,
Oh, over my molars, yeah.
yeah, in the back. So I think some width would help you. Have you done myofunctional therapy?
Just started it, but they wanted me to pause it until I got an appliance out, until I was finished with that.
With what? Have you started an
Getting
appliance?
No, I just told her because I thought I was gonna start I don't know. Dr. Cribbs said that there was one that you guys had talked about. I thought I was gonna start it, but then because of my implants, that one won't work. So I have to do so anyways, I thought I was gonna start earlier, but so I stopped it like a month ago.
Oh, okay. Okay, okay, okay. Yeah, with the implants and stuff.
Yeah.
Yeah. So are you okay messing up your teeth and bite and possibly needing to like replace crowns or get your bite realigned, maybe do braces
Yeah.
or line down the road? Like, because if we start moving your teeth and jaws around, things happen. Developing the bone is different than lining up the teeth.
Right. No, I'm totally fine doing the braces. One thing is, so like I do know I need forward growth. I know as far as like my jaw, developing forward or whatever. So I've looked at the surgery option, but I I I don't because I still have my wisdom teeth, so I can't do that yet. I wouldn't or I can't. I don't think that they will do that. And that wouldn't be, I think the expansion, from what I've read, the most important thing to start with is expansion, anyways.
Mm-hmm, mm-hmm.
And to see what that does. But because I still have my lower ones, at this point, I think they're wrapped around a nerve. So I don't know that I'd be able to really get them taken out. But the upper ones, I don't know. Like I can feel my upper wisdom tooth and it feels like it's really close to the middle of my mouth.
Mm-hmm.
So I don't know if uh, I don't know if Dr. Cribbs ever sent my x-rays for that, or I have a cone beam scan too.
Okay, okay. Do you have it on your computer right there?
I have the cone beam, yes, and I have let me,
Because you could probably pull it up on your computer and share your screen.
yeah, let me see if I can get it. I do, I looked at it, I couldn't really see my wisdom teeth, but there's an x-ray portion that showed it. Let's see. I can for sure. Let's see. Oh,
What's your husband do for work, Leah?
software sales.
Oh,
Um, so he works remote, which is nice.
oh, nice.
Okay, I can't, let me see if I can, oops, share. Okay, I'm not great on Zoom or with knowing how to do it, but
Yeah, just go down to share on the bottom.
oh, share. Okay. All right, let's see. Okay, sharing, I think. Oh, Zoom. Okay. Okay. So this is the cone beam. So this is where I have the actual cone beam itself. Um, but this is where the wisdom teeth, like this one, it looks like is right on top. And I don't know, I feel like I can feel that on the roof of my mouth.
Yeah, yeah.
The X-ray, like it's this one right here.
Yeah.
So I don't like, should I make an appointment to get those ones removed? I don't think the bottom ones are the ones where I believe a nerve is running through the root.
Yeah, it says go down just a little.
Oh, to this part?
Go down a little more. And go down a little more. Do you have TMJ? Do you get headaches? Does your jaw click and pop?
It doesn't click or pop, but it does hurt, and I sometimes have headaches.
Yeah, it feels tight. Okay, go down a little there. So on that, yeah, on that top left, tooth number one,
Hmm.
the left corner, like part of that, it's almost like, no, it's 16. Let's see, go down. Yeah, I guess it's hard to say because we don't have all the angles on this, but yeah, part of those teeth may be bulging out into your palate, which is fine. And yeah, I see the nerve. So there's the nerve right there next to the root on the bottom, but
Yeah.
go down for me there. That's it. Okay. Yeah, no, it's good. So it's possible that if you do the expansion with the Marpy,
Hmm.
it may expose like one of those upper wisdom teeth, might start to move around or something. We've had that when we develop people's jaws. The wisdom teeth start to come through the gums or get a little more visible, and
Hmm.
then they're even easier to take out.
Oh,
So
okay.
that's what I would say. I would say if you want to
Don't
move
worry
forward,
about it.
don't worry about it. But then down the road, it may position itself where it just is like, okay, yeah, let's take it out, and there'll be more room to work with to take it out. And so,
Okay, but the piezo cut, it won't like cut the root or it's
no,
not that long.
no, it's
Okay.
more the piezo cut's more right in the middle, and those
Okay.
are on the sides.
Okay. Okay, well that's one less surgery.
Yeah.
So yeah, that I mean I think that's something I mean I've done all the research on Marpy. I think that's seems like the best option to actually help open up breathing here.
Mm-hmm.
And then I guess could I try doing a face pull mask and just see if it does help anything at all? I'm willing to try because I know I need some growth forward.
Okay. How bad do you need it?
I don't know. I guess, well, let's see. It's right in there that it's like the worst.
How much are you willing to suffer to get it forward?
Like wearing it?
Yeah.
I mean, I mean, I'm home with the kids all day.
Yeah.
Like, does it help? Are you saying that it only like I've heard it's like 16 hours a day?
Yeah. Like, well, one, it's if you wear it 16 hours a day,
Mhm.
8 hours a day, it's relapsing and going backward.
Okay, so it'd be like 24 hours a day.
Yes. So for kids, if you've got a child who's like, 5, 6, 7 years old, they can do 6 hours a day and they'll go, 2 millimeters forward, a millimeter back, 2 millimeters forward, a millimeter back, but they'll slowly get progress.
Okay.
Their bone is soft, their bone is growing, and it's kind of getting a little more out of their natural growth.
Okay.
For an adult who's not growing to try to do a face mask, like you could wear that 24 hours a day and you might or might not get a half a millimeter.
Okay.
Like people are fanatical and hyping this up and desperate, trying anything they can to get forward.
Mhm.
But it's like a face mask on an adult. Like I don't know. I've been doing airway for 15 years and
Mhm.
I just haven't seen any any results on an adult doing it. Like I know there's a lot of people trying things out there
Mhm.
and like I've worked with a lot of stuff. I don't know. Have you done Joe Dispenza?
Who?
Joe Dispenza?
Mm-mm.
No. You're not familiar with him?
Uh-uh.
Okay. He's um but you've read The Biology of Belief.
I've heard of it.
You've heard
Is
of
that
it?
that's not the author, is it?
No, no. Yeah, I think Bruce Lipton, let's see. Yeah, so Bruce Lipton wrote Biology of Belief. Joe Dispenza kind of came behind him, and they do some stuff, but there's like politics and medicine. I don't know, Leah. Do you have family and healthcare at all?
Mm-mm.
Not really.
Mm.
There's a lot of controversy around all this job development stuff. Have you came across any of that?
Mm-hmm.
Tell me what you know.
I mean, just I guess it's people that say you can do something. Someone says, no, you can't. You have to be a certain age. You don't have to be a certain age, that kind of stuff.
Yeah, yeah. So you're a really nice person, and I could tell you're really sincere. And you do want to breathe better, and you don't want to snore. And I do want to help you. Okay.
Okay.
Like I do want to help you. Um, go ahead and stop your share, and I want to do another share with you.
Okay.
So this is someone that he's got an implant right here.
Mm-hmm.
This is an implant. Here's his, but you can kind of see a little titanium right there or something. We could go into his X-ray more, but anyways, he's got his implant, but he's kind of trapped in, no room for his tongue, snoring, stopping breathing. So as we get older, our airways get smaller and smaller our whole life. And sleep apnea used to be a thing of the elderly, and now there's younger and younger people because their mouths are getting smaller and smaller. I mean, you could see he even has all of his wisdom teeth in there.
Mm.
He didn't have any crowding. He never had braces. A little bit of crowding on the bottom.
Mm-hmm.
But like he was snoring, he was getting drowsy, breathing. We did this contraption. So we put this in him. Here's his implant.
Mm-hmm.
So he wore this for almost a year. He wore this for 9 or 10 months.
Mm-hmm. Wow.
But you could see we got him forward.
Yeah. It was truly moving the bone.
Yes.
It was moving the bone, not the teeth.
The teeth moved too, but yeah, both.
So like the implant that wasn't affected because it was still in the
We're moving the bone forward.
right.
So then we put his braces on. We could have done an implant here and gave him another crown, and he'd have his wisdom teeth and extra. This space didn't open up quite as much. This side didn't go forward as fast because this is the implant. The implant was kind of on that side.
Hmm.
But we did get enough that it changed his life. He's breathing better, sleeping
Hmm.
better. We brought all the back teeth forward. So we closed up all that extra space by bringing the back teeth forward.
Hmm.
So he was like, he's really happy with his breathing and sleeping and everything.
Hmm. Wow. So, but that is that even an option for for me?
So, Leah, this is just between me and you, okay, right now? Is that
Uh,
fine? Okay. This is, this is a chiropractor, and she had 8 permanent teeth pulled when she had her orthodontics.
okay.
You've heard about that.
I had teeth pulled, but I think they were all my baby teeth. I don't think they pulled the,
So she had baby teeth pulled, and then she had 8 permanent teeth pulled.
wow.
Super, super small mouth, no tongue space. In the 80s, I think 10 or 20 or 30 years ago or something, she tried to get some widening. So you can see how, like, this is kind of V'd out.
Hmm.
So at some point, you've probably heard of the Alf and the Crozettes.
Mm-mm.
So it's something that widens out. So she went to someone and she had the back teeth widened out a little bit.
Hmm.
Um, and so she's trying, but she's desperate. She wants to get the forward. So
Oh,
we're
wow.
do some things, but so you could see, I don't know, it's kind of hard to tell at that angle. I'm like, her
Hmm.
mouth is so small we can barely get our mirrors in there, but you could see there's a little bit of space here.
Uh-huh.
So you can see these are together here. These are together here.
Yeah.
Now you see we're getting a little bit of space here.
Hmm.
And we're getting more space here. We have about 5 millimeters here or something.
Wow.
These are 2 implants, just 2 implants right here.
Oh, wow.
So it's just so slow. It's like the side without the implants,
I see. Yeah.
way bigger. So this,
Yeah.
like,
Yeah.
so you can see, like, this is right here. You can see how much open. You can see that whole tooth practically.
Yeah.
And this one, it's like,
I
I
see.
mean, it's got something, it's there,
But hardly.
but just hardly. So, but you've got one implant here, one implant here. Um, so the thing is, yeah, so, um,
Because the implants are saying that stops the jaw even more.
yeah,
Or
it slows down the bone remodeling.
okay.
Yeah. So kind of what's going on, Leah, is a lot of dentists who have done those appliances that can work with implants
Mhm.
have been sued.
Okay. I haven't found I don't like moving forward.
Yeah.
Okay. I haven't found anyone that is able to do it even. So they're sued because is it the teeth are coming out or
Because there have been a few patients who went to an orthodontist who says, you can't do this, it's not possible. and then they can't do it anymore. So
Oh.
there's the standard of care. So with vaccines, it's like getting the COVID shot was the standard of care. But there's a certain number of people who didn't want to get the COVID vaccine.
Hmm.
But the acceptability of not getting the COVID vaccine during COVID was very low.
Hmm.
There was a lot of political pressure. A lot of doctors who did not follow standard protocol on that had their licenses taken away.
Right, right.
You heard about that kind of stuff.
Yes. No, yes, I understand. Yeah.
I mean, I didn't get the COVID shot, and one of my patients said I should lose my license
Right.
because I don't want
That's
to
what
get
you
the
mean with the politics, like in health.
yes. Because orthodontists say you can't go forward, you shouldn't go forward.
Because it's not
And
the standard of care.
because it's not the standard of care. In 1860, the first dentist went lateral expansion widening. He was expelled from the dental society.
Right, because it was new and
There was no, you couldn't do it
right,
until 90 years later in 1950, it became acceptable and a minority of people were doing it.
right,
But from 1860 until 1950, it was very, very frowned upon.
right. Like wisdom teeth, right? Like standard of care is to remove them, but they actually, if you can have them come in, right, it's better for you usually.
Yes. Right,
But
right.
they have to, but they don't want to, but they could get sued if they don't remove them and there's like an infection or something.
Yes, kind of, yeah. So
Okay.
there's been dentists doing the forward jaw development since the 1980s. 1950s on kids. Go ahead. If you want to check in, go ahead.
Okay. Let
No,
me get him a granola bar.
time. Yeah, take your time.
Okay. Um, so it's frowned upon to try to attempt to get the forward growth still.
Yes, that's right.
Okay. And is it because it doesn't really work or it's not good for
Um, so it's because it's not standard practice and people don't believe it can be done.
okay.
So, like if you look, like these are some of my case examples. It's like, did I get this girl's jaws forward? Did I get this girl's jaws forward? Can you see that?
Mhm.
Yeah. Can you tell like it goes back in more? It's more forward
Yeah.
here. Like, can you tell if her upper jaw came forward?
Yeah.
Can you tell if her jaws came forward?
Hmm.
Here's her front smile.
Hmm.
We also got this up and forward.
Hmm.
So you can't move people's jaws upward without surgery, and you can't move them forward without surgery. But
Hmm.
that's what I do. So her jaws came forward.
Hmm.
She had a lot of crowding. She would have needed teeth pulled for her braces. Here she had room for all of her teeth, didn't need any teeth pulled.
Hmm.
Same thing here. She needed teeth pulled. We got her jaws a little up and forward.
Hmm.
But and I could show you a lot of adults too. I mean, there's someone let's see.
So that's why it's hard to find people who post adult stuff is because it's not standard care practice.
Yeah, people are afraid of getting sued. People have been sued, and so
Right.
less people are wanting to do it.
I see. Okay, that makes sense. Oh, wow, that's a big difference.
So here's her profile.
Oh, yeah. Wow.
But you can kind of see like she just wasn't sleeping great.
Mm-hmm.
You know, her teeth were trapped in. Um, so we opened up. So we opened up her spaces. We brought things forward a little bit, and then she had a little bit of space in the back. So
Mm-hmm.
we did some fillings. We bonded. She
Mm-hmm.
still brushes and flosses like normal, but we're holding those forward.
Mm-hmm.
So we're just, she started, so she started with this.
Oh, wow. Okay, but she got more space because she didn't have the implants.
Right, that's right. Yeah, so it's not possible to go forward so people get sued, but like did I bring these teeth forward?
Right.
Are her teeth still doing okay? Like, here's her
Wow.
teeth.
Right. Right.
So, but because a lot of dentists have been sued, there's more and more people are unwilling to do this kind of treatment. And it's like I'm trying to move this forward, I'm trying to help people, but a lot of people
It's
are afraid of what everybody else thinks, and they don't want to do something if everyone else doesn't approve of it. So
right.
it's how much of a political activist are you, Leah? That's my question, because that's what we're dealing with. Like
Right.
a chiropractor I'm treating who's doing this, who, like in 1989, the American Medical Association was found guilty in a court of law in the United States of America of conspiring to outlaw chiropractics.
Oh,
So
wow.
in the 80s, it almost became law that chiropractors were not allowed to practice in the United States of America. And if that would have happened today, we'd all have to go to Mexico to go to a chiropractor.
Right. Right.
A legal battle, the American Medical Association was found guilty of conspiring against chiropractors, and they won. And so now chiropractors are all across the US, and we all see them. But in the 80s, it was very like extreme to go to a chiropractor, and it was not fully accepted by the general public.
Mm. Wow, I didn't know that.
So she gets it. Like she's like, I don't care what they'll say. I want to do this. I need to get my forward. Help me, right?
Mhm. Right.
But most people aren't that extreme. You've got to be extreme to like be a political activist to start on a treatment that everyone says is impossible. You can't do it.
Right.
And
Right.
you've got to face doctors, and you've got to give enough reassurance to the doctor. I want this. I appreciate you. I know you're risking a lot by even treating me, but I
Right.
want to help this movement. I want you to publish my case. I want you to share my x-rays and photos with other doctors, other people to show that this can happen so we can
Mhm.
change the status quo. Because the status quo is not going forward. Right now, it's taken 150 years to get people to widen and have that be accepted. Now everybody widens. I
Mhm.
hope it doesn't take 150 years to help people go forward. I'm trying to
And
make that happen. So,
you've seen this work. Like it's not like I guess the implant thing does stop it, but you've still seen that happen.
yeah, so I have 3 patients with implants that we've done their forward.
And it's like 2, 3, 4 millimeters forward, you think, with that?
I mean, well, the one we're going, she's still in it right now. So we've got like 4 or 5 on one side, 2 or 2.5 on the other side.
Mhm.
One lady, I think we went forward like eight
Wow.
millimeters.
You can see it from the what is that called? Um
The nose lip angle.
yeah, the angle. Yeah, yeah, yeah.
Yeah. Um,
Because I mean,
yeah,
that's,
based on that guy, he had like 8 or 10 millimeters on one side and then like 6 or 8 on the other side,
yeah,
right?
yeah.
Um,
And the CB, the cone beam scan even, and it showed the airway from that opening.
um, yeah. I mean, the cone beam like shows a better airway. Yeah, yeah. I mean, so here's one of our patients. This is like before and after on the cone beam. So
And that's
five,
from the forward growth.
yes, 5.5 front to back to 10.3.
That's crazy. Wow.
Yeah. So I believe in forward almost as much or more than anybody else.
Hmm.
But I kind of hesitate bringing it up, especially with implants, because you've got to really want it
Hmm.
to wear a contraption in your mouth for a year.
Hmm. Is it
And
similar to the DNA device or?
no. You can't do what I do with the DNA.
Okay, so it's more, yeah. I'm very interested. That's something because I would do the surgery if I didn't have the issue with my nerves around my wisdom teeth.
What surgery?
Um, doing MMA.
Oh, the double jaw surgery.
Hmm.
Wow. Yeah, good for you. That's great. Well, and the thing is like, I mean, which shows like you really like want to find a way, right?
Well, I want to if I can without that because I don't know if I even can do it because of I don't think there's room for them to make the cut on my lower jaw.
I'll take out your wisdom teeth and then they can do it.
But I think my nerve is around there, so I could lose.
It's beside it. Like
Oh.
you can find someone to take out your wisdom teeth. I mean, because I have my piezo. That's the thing. Most oral surgeons don't use an ultrasonic. It's too slow.
Hmm.
But ultrasonics do not damage nerves. It's very, very
Right.
safe.
Right. I read that.
So, like, you can work around nerves with that, but it's just you just need to find someone willing to work around the nerves with that.
Have you heard of anybody that does extractions with a piezo?
Yeah, me. Weren't we talking about you coming out to Oregon?
Oh, I didn't know you extract wisdom teeth?
Yes.
Oh, I didn't know. So if you were so with the lower ones, you would use that instead of whatever something sharp that they would use in an oral surgery to get the wisdom teeth extracted.
Yeah. And then you could do your MMA.
Right.
But I'm not convinced that's the best thing for you in the long run. I'm really not. I think getting you forward non-surgically would be better for you,
Mhm.
but it's just, connecting you. Are you willing to travel somewhere to get with a doctor? Because I haven't even, honestly, I didn't even tell Dr. Cribbs about this because
Right.
I don't want her vulnerable. I don't want her, like, if she's like, I don't want her to get sued. I want her to build confidence. I want her to be successful. I want her to do good things. I don't want to put her in a position where she's getting sued and then she stops helping anybody.
Mhm.
That
Mhm.
makes sense?
Mhm.
But so I don't so I don't even want you to tell Dr. Cribbs we had this conversation, to be honest, Leah.
Mhm.
And if you,
Yeah.
you can, if you want, I could talk to her, but okay, maybe we could talk to her. I don't know, but like, I want to build her confidence, not make her more nervous to do this.
Mhm.
Can you appreciate that? Does that make sense?
Yeah. Right.
But here's the other lady with implants. So you
Mhm.
could see her here, and then this is after.
Oh, wow. Yeah.
So,
Hmm. And so that would take a year. And so that would just be forward, though, that wouldn't be expanding.
It does a little bit of expansion as well.
Okay, so would it maybe be like possibly two procedures or two appliances? Like, so one forward growth and then later expansion.
Yeah, yeah.
But that would be first, do you think, the
If
forward?
you really want to get your nose breathing, the Marpy is great for that.
Hmm.
So, in fact, there's another dentist of mine who I think was going to do this with the forward and then do the Marpy for the width. Like,
Hmm.
that's really the best. But my experience, once people have done one or the other, they don't want to do both. It's like, how many years do you want to walk around with stuff in your mouth? You know what I mean?
Hmm.
So most people kind of get what we call treatment fatigue. They're like, I'm done with this contraption. I'm done with dealing with all this. I've had enough improvement. I'm good. I'm not snoring anymore.
Hmm.
You know what I mean?
Hmm.
So it's kind of just all a balance.
Right.
So
And
I've
then what
done
do
a
you do with the lower jaw if you expand the upper jaw? What about the lower jaw?
we guide it forward.
It just, and how do you, with like a mandibular advancement device or
No, we just naturally.
like a retainer?
No.
Like,
Like,
does it
'cause
just do it on its own or?
you saw how much we brought her upper forward and
Uh-huh.
her lowers there.
Hmm. So it, like the body just naturally does it then?
Yeah, that's right. We do some things. We level the bite. We do some bite adjustments. Right here, it was this. It's a little bit back. During the middle of treatment, there's a point where there's the lower's a little farther back, but over time, the lower remodels.
Mm.
So it has to do with the bite. I don't know. I think you might have saw she had some bonding on her bottom teeth.
Hmm.
I think she's got. I think I might have taken it. But if you look close, there's a little bit of pink bonding right here.
Okay.
You kind of see that's a little pinkish.
Hmm.
I think I took it off at the end. So, but at the beginning, so she didn't have that.
But that helps her, the bite, her move it forward. Oh, because it levels the surface.
That's right. So when our teeth puzzle piece together and our lower and upper teeth kind of lock in into our bite,
Hmm.
it holds the lower jaw where it is.
Hmm.
Close your mouth right now and bite in your full bite. You can't really go backward and forward. You kind of have to go over a speed bump to kind of move your jaw forward or backward
Hmm.
because all the ridges kind of lock your bite in, right? Which
Hmm.
kind of keeps your jaw where it is. But your jaw is uncomfortable with your teeth together.
Right.
Your jaw is a little more comfortable when it's slightly open and slightly forward,
Hmm.
and your tongue comes forward a little bit,
Hmm.
right?
Yes. Yeah.
So when we get that upper jaw forward, all of a sudden the lower jaw can relax and come forward where it wants to be a little bit.
Okay.
But you're still biting and chewing and functioning in your normal bite.
Hmm.
So we do that little bonding sometimes to take away the bite. Because when we take away the bite, neurologically, our body wants to keep our teeth together. Our
Yeah.
jaw, we're hardwired for our jaws to chew.
Hmm.
But when we do that smooth surface and the teeth no longer lock in, they can slide forward and backward easily.
Hmm.
And
To
then
what's
the
comfortable.
and then the body says, "Oh, we don't have our chewing place. We don't have to stay there because we can chew anywhere now." Chewing is the same whether we're back or forward.
Okay.
Because people feel a little more comfortable with the jaw a little more forward, they gradually hold the jaw a little more forward there. We
Hmm.
take away the bite, which is holding it back, and
Hmm.
now they start to bite and chew and function with it a little more forward.
Hmm.
And in biology, form follows function. So as they function with it forward, because the upper come forward. So when they talk, we bring our teeth together in a certain way to make sounds. And so as that happens, they bring the lower jaw forward as they're speaking. Then the
Hmm.
whole shape of the lower jaw changes and remodels. to position to the more forward position that the upper jaw is now at.
Right. Okay. Right. I've read and heard about that.
That kind of makes sense.
Yeah.
So I don't know, like the guy we did with his implant, like his head shows that. So he had that. We got him coming forward. I mean, that's the thing is his jaw wanted space. So it's like your jaw wants space, right?
Hmm.
His
Hmm.
jaw wants space. It's like you can't even see a big overbite or overjet. It's like his jaw comes forward right with it along the way. I guess I did do the bonding on there, so that stimulates that forward on the lower jaw.
Hmm.
But you see all this space here,
Yeah.
and his lower jaw's forward right up with his upper.
Right.
So 9 times out of 10, it's a non-issue. People's jaws want to be forward and it changes shape. If I gained 300 pounds, my body changed shape.
Hmm.
I didn't grow,
Right.
right? If
Hmm.
I weigh 500 pounds and I lose 300 pounds, my body changed shape.
Hmm.
When somebody gains or loses 300 pounds, their bones change shape and change
Hmm.
density. If
Hmm.
you've ever seen somebody get cancer who gets super, super small, they get so small and thin and fragile. Have you ever seen anyone just wasting away, like super skinny?
Hmm.
It's like their bones are changing shape. And then I've seen them miraculously recover from their cancer. They're supposed to die, and they get back to normal, healthy weight again, and their bones change shape again. But people's bones, when they're dying, their bones get very, very small,
Hmm.
very thin. You can almost see their skin laying on their bones. Nurses who've been in hospice care and all this stuff have seen this kind of stuff. But we're changing the shape of the mouth. So that's a big controversy is you can't grow the jaws. Well, there's things you can do to stimulate a change in shape in the jaws.
Hmm.
The examples I've just showed you, we're not helping make anybody grow their jaws. We're
Hmm.
stimulating a change in shape of the jaws, getting the jaws more forward, relaxing the jaw muscles, opening the airway. We've had couples sleeping in separate bedrooms because the snoring was so bad, and now they're sleeping in the same bedroom. And it's unfortunate with the politics around this because less and less doctors are doing this because of the politics and the legal issues.
Right. Right.
So, given all this, is this something you're still interested in? How
Yes, yeah. I
more?
am. Yes, no, I am. I think I've read like with some there was I think some case where I read someone got sued because of the growth. And I don't remember why, because I think everything turned out fine, but I think they were saying it was like the possibility of like teeth dying, which can happen in orthodontics, right?
Yes.
So that's the big fear, right? Is a tooth dies or something like that,
Yes.
which can happen at any time, but that's I guess where but you haven't like I mean, have you seen that, I guess?
I've talked to some of the doctors who've had these lawsuits.
Okay.
There's three things. One is a lot of these patients wanting this treatment have had retractive orthodontics. They've had the 8 teeth pulled. They're desperate for anything. They want to change.
Mhm.
And I've treated some of these patients, and they're like, okay, I've been in my plans for a year. I know I'm supposed to transition. I want to do another 6 months. This has been amazing. You've changed my life. I want to do another 6 months. And there's sometimes it's okay to do another 6 months, and there's sometimes you should not do another 6 months.
Mhm.
And so sometimes the patients themselves have pressured the doctors to go beyond what they should have done.
Gotcha. Okay.
And then when there was a complication or something, they blame the doctor because the doctor should have known better. The doctor shouldn't have done it.
Right. Right, right, right. I
And
get
they
how
don't
that.
take responsibility that I was the one that pressured you in the first place.
Right.
And then they turn around and sue the doctor.
Right.
That has happened.
Right.
So that's one scenario.
Now, I saw with one of, oh, sorry, there was more scenarios. Go
Two
ahead.
other scenarios. So another scenario is there's been some training organizations training people, promoting doing things that were outside. Okay, you want me?
Sorry.
Okay. So there's been some training organizations and some doctors teaching people to do things that are outside of what an appliance was designed to do. Just going above and beyond. Let's get better aesthetics. Let's get better profile. Let's make this even better, right? And so some dentists who were learning to do things did what an experienced person never would have done
Mhm.
because they had the proper training and they know what you can and can't do. So there were some dentists who were told some things were safe to do that were not safe to do that got themselves in trouble and got under the radar. So that has also happened.
Okay.
Okay. Then because of all the controversy around this, there are some patients who are being properly treated by an experienced dentist who knew what they were doing, but got nervous because of all the politics and the stuff on the news and people talking and all this, and went to a standard of care traditional orthodontist for a second opinion to get some reassurance.
Mm.
Were told, you can't do this, you never should have done this, you need to go see my oral surgeon. They go to the oral surgeon. Oh my goodness, you're losing bone, you're losing your teeth, you need your teeth extracted, you need all implants.
Mm.
And they went through with the surgery, had their teeth pulled, and got the implants.
Gotcha.
Then the dentist got sued
Right. I see how that. Okay.
because he's not doing standard of care. When if they would have went back to that dentist or they would have came to me for the reassurance, I would have showed them all my cases. I would have given them the reassurance. They could have gone back to the dentist and had a successful case and not had any teeth pulled,
Right.
and they would have been fine.
Right.
But they went to the orthodontist who said, this is not possible. This is dangerous. Now you need your teeth pulled. And they
Mm.
had the teeth
Mm. Right.
because they went to someone who didn't believe.
Right. Right. Who had a different school of training. So what would the cost, I know you have to go, what would the cost be for the, if you think that I could do something that is forward growth, do I have to come out to Oregon and what would that look like?
I mean, so I could probably find someone either in New York or Texas.
Okay.
And I think they charge, I don't know, somewhere between ten or $20,000.
Okay. And the MARPE would be something Dr. Cribbs could do. She could do the cut and install the tags.
Yeah, we could work with one of her colleagues that has, so she knows someone, she has a colleague who has a piezo that we could get them up to speed with what we're doing, and I think they could treat you just fine locally.
Okay. And what would, or would she charge me whatever that would be?
Um, yeah, so yeah, her private dentist who's going to do the surgical aspect would charge you for the surgery, and then she would charge you for the airway treatment.
Okay. Okay. And then the airway is a $5,000. I think I got an email-ish about that.
Yeah, something like that or something.
Okay.
Yeah, I don't know, like
Okay.
yeah.
Okay. Well, yeah, I'll do one or the other. The forward one, is it stay in my mouth? It's permanent. They both are permanent. And they both take about a year.
Yeah. Yeah.
Okay. About 1 year. Um, well, I'd probably just based off of cost, I'd probably do the expansion first before doing 10 to 20,000. Um, and I know my nose is an issue because
Maybe yeah, that's gonna help your nose. Maybe that's gonna get you what you want.
right. So I think
Right.
so from here I'll call Dr. Cribbs and then she'll, I guess, work with you and maybe her colleague
Yeah.
who has a piezo. I didn't know she found somebody. That's awesome.
Yeah, 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 yeah,
Okay.
yeah. So
Okay.
I need a schedule. So I'll schedule some time with her to go over this. And I wanna want to get them up to speed, but they're fully capable of taking really, really good care of you, Leah.
Okay.
So even though people are learning, this is not rocket science, but it's just a different kind of toothbrush, if you will.
Yeah. Do
Going
you
from,
do you ever cut the suture that's like behind the vac molar back or I don't remember what it's called, but there's I I think it was like starting with a P. No,
here,
Zy
here, go ahead, play it or something.
uh it was on I think I could find it really quick. Sorry again. If I can't find it, that's okay. I'll just it was on uh I think it was in here called wasn't it? Sorry, I might email you about it, but there's some, I guess people who do the MARPE, they cut also using I don't know if what they use, if it's a piezotome or not, but it's one of the sutures back. I don't know. Maybe I'll email it a
That's
picture.
to set the stage for the face mask, then.
What's that?
That's for the face mask.
Oh, maybe. I don't know.
Yeah,
Uh,
find it and email us. Let me know.
okay, yeah, I will. I'll find it on here. It's something I read recently. So, it shouldn't be too hard to find. But yes, I'll email it over and see if you've heard of it or know what that is or recommend it.
Yeah, yeah. No, sure, that sounds good. Was this helpful, Leah?
It was very, very helpful. Yes, I really appreciate it. I got a lot of my questions answered. So thank you.
Yeah,
Thanks
yeah,
for spending so much time too. I'm sorry.
yeah, that's okay. Happy to help anytime. Reach out. I have some things scheduled and whatnot, but I'm gonna try to get with Dr. Krebs and our colleague, maybe like the first or second week of October.
Great. Okay.
Does that
Yeah.
sound fine?
Yo, yeah, that's totally fine.
Okay. All right. And then yeah, we'll circle back and make sure we all like look at the scans and help get the very best result that we can for you.
Okay, that sounds great. Thank you so much.
Okay, you're welcome. Thanks, Leah. Bye
All right,
bye.
bye.